Did you know that chest pain can be a sign that you're having heart disease? Hello our dear viewers, you're welcome to our YouTube platform, Health Tips and Tricks. It's your physician, Dr. Andrew, to take you through. And today we are going to look at something interesting. We are going to see what are some of the signs or symptoms that can show that your heart is not working well. And without wasting further time, we are going to begin immediately. So some of these signs can be, some of these signs or symptoms, you could see them among your relatives, even you yourself could be having them and you have not yet noticed. And with heart disease, it is better for it to be detected early so that it can be treated and you recover very well. So what are some of these? Number one, you have chest pain. Chest pain that is not clear, that you have been having for some time and it is on and off, especially if the chest pain is in the center. Chest pain can be on the right side, on the left side, or in the center, especially if it is in the center. And this pain increases when you do an activity. So you have such kind of chest pain, then you need to go for a checkup for your heart. We have things like chest tightness as well, which can also be kind of chest pain. Pressure, feeling something heavy seated in your chest, all these can be signs of heart disease. And then you have shortness of breath, having to catch your breath. You do something small and you feel you're short of breath. This can also be a sign that you could be developing heart disease. And then you have pain in the neck, pain in the jaw, pain in the back, pain in the shoulders. If you have any kind of this kind of pain, then you need to go for a heart check. Also pain in the upper belly. If you have pain in the upper belly, not all pain in the upper belly is coming from the abdominal side. Sometimes it could be heart disease. And then you have things like dizziness, feeling dizzy. For example, as you try to get up from sitting position, you feel like you're going to fall. If you have that, it could be a sign of heart disease. Fainting and almost fainting. Some people, when they stand for long, all of a sudden they fall down and faint or get what we call syncope. So if you have any person who gets this or you get this, then you need to have your heart checked. We have what we call faltering in the chest, and this is when you feel something beating fast in your chest. It can be related to it's in line with this also of a racing heartbeat or a slow heartbeat. Being aware of your heartbeat and you feel your heart beating even without doing any activity, this can be a sign that you have heart disease. Lightheadedness, which is related to dizziness, can also be a sign that you have heart disease. Then sometimes when you do a small activity, maybe normally you've been walking to work, maybe walking to the shops, and you've been fine. But all of a sudden you start, when you try to walk to work, you reach there and you're feeling breathless. You feel short of breath, yet you have done an activity which you have always been doing. This could be a sign of heart disease. Maybe when you go to sleep, you feel you are short of breath and you have to get up and sit in bed, or you have to go to the window to catch a breath. Then this could be a sign that you're developing heart disease. And then having swollen legs, swollen ankles, or swollen feet can also be a sign that you could be having heart disease. Another one is fatigue. You feel tired all the time. You feel like you've been working so much, yet you have not been doing anything. So this can also be a sign that you have heart disease. Thank you very much for your attention and for listening in. I remain your physician, Dr. Andrew, and we have summarized some of the things that can show that you could either be having heart disease or your loved one could be having heart disease. Kindly subscribe and feel free to come and watch our videos again. Thank you.